On March 11, 2020, the World Health Organization declared the deadly COVID-19 a pandemic after the virus spread like wildfire, infecting more than 118,000 and killing over 4,000 people within 2 weeks of detection. After 3 years of battling the pandemic, the global community can now heave a sigh of relief as the World Health Organization declared an end to COVID-19 as a global health emergency. In 2023, our correspondent Folashade Oguride in this report takes a look at COVID-19 pandemic and its impact on Nigeria.
The world came to a standstill in 2020 when the full force of a novel virus hit the world population. People watched in disbelief as news channels aired distressing visuals of casualties as many health facilities struggled to contain the COVID-19 virus. Nigeria, like many countries, was not left out of this unprecedented situation. After reporting its first index case in February, a lockdown was called to stem the rising number of infections.
I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020.
It's unclear just how much Nigeria lost in economic terms to the pandemic, but the World Bank says the early parts of the COVID-19 crisis ushered in Nigeria's deepest recession since the 1980s.
Which, when you consider the fact that at that time, we were only just recovering from our own recession, the recession we went into in 2016, and recovered from gradually up until 2018, thereabouts. We were in recovery, and then COVID happened. So it was a double whammy. And the impact and the meaning of this is, even now, 2023, 3 years after COVID, 3 years after that recession, there are things that we are battling with that have resulted on the long run, if you look at the long-term effect from COVID, that you can trace back to the fact that COVID happened and took us back into recession. One of them is the inflation rates that we suffer right now.
For experts, the pandemic presented an opportunity for stakeholders to glean important lessons and develop working strategies.
Strongest representation of NCDC should have been at the local government level, even at the ward level. So you have a strong structure of people who go for both sanitary inspections, health prevention talks, education of the populace. So this base has to be there. And then we go up to the local government level where they monitor disease prevalence in the local government and set up alert systems. Then you now move up to the state NCDC, which now has a more comprehensive system.
Thankfully, efforts to curb the COVID-19 through vaccination and other strategies appear to be taking root. Having recorded a significant drop in death and infection rates, the World Health Organization declared that COVID-19 no longer represents a global health emergency.
The emergency committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern. I have accepted that advice. It's therefore with great hope that I declare COVID-19 over as a global health emergency.
Nigeria's public health body, the Nigeria Center for Disease Control, NCDC, had taken a similar stand in 2022. But the NCDC's Director General, Ifedayo Adetifa, says the threat of the COVID-19 virus remains within many countries, particularly for high-risk groups. So far, the country has recorded a total of 266,675 cases, with 3,155 deaths, ranking 14th on the continent in terms of the fatality rates. Folashade Oguride, TV 360 News.